Hello, my name is Olivia Huffman. I'm a graduate assistant with Dr. Lawrence Judge at Ball State University. Today, I will be briefly sharing our findings from Drs. Judge and Beller in my study on the association of the frequency of resistance exercise with GPA and psychological well-being among college students. There is a mental health crisis among college students as depression and anxiety continue to increase while mental health services are overwhelmed on university campuses. People are engaging in exercise less, and rates of comorbidity are increasing, including mental health concerns. According to the CDC, 53% of people are meeting aerobic guidelines, but only 23% of people meet both the aerobic and muscular strengthening guidelines. In line with previous research, males of ages 18 to 24 tend to outperform females for both exercise guidelines. Thus, gender differences should be considered. For all students, their time in college offers freedom to navigate their classes, personal life, and other factors related to their health and well-being like exercising, which can be pretty stressful. Research suggests that when well-being and mental health decline, GPAs tend to decrease as well. There is an association with general exercise within a certain range in well-being outcomes. In fact, exercise has been shown to decrease or prevent minor to mild symptoms of depression and anxiety, all the while increasing cognitive abilities. We hope to add to the literature surrounding how resistance training can improve cognitive ability and well-being in the college student population. Specifically, the purpose of the present study was to examine the frequency of college students engaging in resistance exercise and its associated impact on GPA and psychological well-being. So after IRB approval, participants from Midwest state universities completed the Leisure and Physical Activity Questionnaire in order to quantify frequency of aerobic and resistance exercise per week. They also completed the Profile of Mood State Scale, which is a psychological rating scale used to assess transient, distinct mood states. The demographics for our participants for gender and age are seen here. Using multiple linear regression, significant models predicted total mood disturbances from the POMS scale were identified. Within the significant models, lower mood disturbances were associated with higher GPAs and increased frequency of resistance exercise, while aerobic exercise and gender were not significant predictors. To give you a better picture of our results, here is a graph which shows how resistance training and GPA may relate to mood disturbances. Specifically, increased frequency of resistance training, 6 to 7 days per week, and higher GPA were associated with lower total mood disturbances among the college students tested. These results suggest that college students who engage in higher numbers of resistance training sessions per week may have improved well-being and better academic outcomes. As universities attempt to offer psychological support to students, a preventative approach grounded in resistance-based physical activity may be the answer. Requiring physical activity in the core curriculum is one example of how this can be implemented for college students, especially for those on traditional residential routes. Those living on campuses should consider adding or starting resistance training programs at their recreation centers, and universities should help facilitate this for students. Some limitations of this study include our small sample size and ability to generalize our findings to other ages, gender, and ethnic groups. While there was no significance with the predictor gender, research suggests that females tend to participate in less resistance training. Additionally, I would be curious to investigate if and how ethnic groups differ in frequency of resistance training, GPA, and well-being. Here are our references. The floor is open for any questions. Thank you so much for listening. Please feel free to contact us at our emails below.